Ladies and gentlemen, I'm happy today to speak with you about a most important chest disease and to see whether the patient can fast or not in Ramadan. We will speak about asthma. Asthma means an acute attacks of dyspnea, chest tightness, wheezes, and cough with very viscid and little sputum. These attacks differ from person to person in severity and duration, and also the recurrence of it. Asthmatic attacks result from interaction between genetics and environment. And there are two different types of asthma: extrinsic type and intrinsic type. Extrinsic type means we can detect the exacerbating factor in this category. Exacerbating factor for attacks, we can detect it by many laboratory investigations, but the intrinsic category or intrinsic type, we can't detect the exacerbating factors, and so we call it as intrinsic type or intrinsic factor. The exacerbating factors, we will go with it in short. The most important exacerbating factor is the house dust mites. House dust mites is an microscopic insects. It lives in the house dust, especially in bed linens and carpets. Also, its survival increase and the multiplication increases with the humidity and the low temperature. Also, the second item which nowadays we go with it in brooding, which wasn't present in Egypt before, but nowadays are present on a large scale, the fungal spores. Fungal spores increases also with the humidity and high temperature. Mites with low temperature and humidity, but this in high temperature and humidity. The third item of exacerbating factors, pollens. And pollens differ from season to season according to the sensitivity of the person to this pollen. So the attacks of pollens is called seasonal attacks. Also important item, but in children and infants, the food. The food is called an exacerbating factor for allergic asthma in children and infants, but has no large role in adults. Also, an important item is the animal furs and hairs. Birds, feathers of birds, but it's considered also as an important exacerbating factor and specific factor. The cockroaches is considered also an exacerbating factor. Also, the analgesics and the anti-inflammatory drugs, especially the aspirin. Aspirin is considered a very dangerous exacerbating factor for a fatal attacks of asthma. So we must take care from the use of aspirin and all anti-inflammatory and analgesic drugs, especially in asthmatic patients. These are specific exacerbating factors, but there are non-specific exacerbating factors. This means that any asthmatic patient, when gets this exacerbating factor in his environment, will gain an attack. These non-specific factors is smoke, fumes, also the cold air, and street dust. The exacerbating factors, whether specific or non-specific, will go an interaction between the immune system, and the result will occur that a very large number of inflammatory cells and chemical mediators which will produce the bronchoconstriction and the very high viscid mucus which will obstruct the peripheral bronchi and will obstruct the passage of air to the alveoli. These attacks and from the exacerbating factors as I described it, we will put many red lines on the subjects which you must protect yourself from it if you are asthmatic. If we in the house, we must take care about the cleaning process. Cleaning process must be by air drafts and air suction, not by any cleaning which will produce scattered dust in the house and will cause inhalation of these allergens, biological allergens which are present in it and which will cause the asthmatic attacks. Also, we must take care from the cockroaches, which are very important allergenic factor which neglected by most of the persons, which very dangerous element which was not known before. And also we must take care from the stored vegetables and fruits in the closed areas which suffers from high temperature and humidity, which will produce more and more of fungal spores. Management of asthma will be constricted in a very important item, the prophylaxis. Prophylaxis from the exacerbating factors mentioned before, especially if the specific factors known by investigations and skin tests and specific immuno tests. And also we will constrict the management in the use of inhalers, especially two types we will use it. The first is the anti-inflammatory inhalers and the bronchodilator inhalers. And the inhalers of the bronchodilator and the anti-inflammatory have nowadays a revolution in it is manufacture and also the long term of use of it, which increases the compliance of the patient to these inhalers. And also we must know that the high intake of fluids will also diminish the viscidity of the sputum, and also this will makes the patient get rid the bronchial discharges and clears the peripheral airways, and also will get out from his attack. And so from this point we go to the first item, which we will speak on it, scoping now, that if the asthmatic attack is uncontrollable and severe, so the patient must not fast. If the asthmatic attacks controlled and the patient under regimen of therapy which will not suffer from an attacks during the day, so he can fast. So this item we must revise your doctor and his advice to you that you will fast or not according to the severity of the asthmatic attacks and also the recurrence of attacks. Thank you very much.